Hello everyone, I'm Dr. Mandell. I want to say welcome. Hope you're having a beautiful day or night. I want to say hello and welcome to everyone out there. Today's program is going to be very special. It's about my two favorite friends, garlic and omega-3. The big question that comes up is about clogging of arteries, heart attack, stroke. We look at plaque buildup that goes up in the arteries, the carotid arteries, the coronary arteries, anywhere. How do we unclog this? What is the best thing that we can do from a nutritional and medicinal point to do something naturally where we don't have to rely on statins and other dangerous medications? I've done my homework, so just please bear with me, and I'm going to try to put all this together. First of all, when we look at the heart, or we look at arteries, we look at two things here, arteriosclerosis and atherosclerosis. I'd like you to know the difference on both of these. Arteriosclerosis is generally a stiffening or hardening of the artery. When the walls become very firm and hard, they're not flexible, which can raise blood pressure and cause other problems. Atherosclerosis is probably what you hear more of when it comes to cholesterol and building up of clogging the artery. This is when the artery actually gets narrowed by a plaque buildup. So atherosclerosis is a specific type of arteriosclerosis. I want to just review some important things. If you look at this here, what everyone seems to look for is cholesterol. And what happened to cholesterol? I mean, cholesterol, 200 milligrams per deciliter now is the borderline, but years ago, it was 300, 325. What's going on? I wonder. You know, the drug companies are saying we can't push our drugs unless we get those numbers down. 96 million? I don't know how many millions of people out there who are over 200 today. I don't see everyone dying. So something's very corrupted. But I'm not going to talk about this program, but I want to kind of keep it on a positive note. I'll try to move through it really quick. My main intention today is to throw you the studies, some important studies by the most recognized medical institutions worldwide. If you look at this picture here, you look at cholesterol buildup. As you have more cholesterol, you have more stenosis, more narrowing, more plaquing. You can see from the left of the lumen of the artery, as it progresses to the right, it starts to continue to narrow on. So it's just not cholesterol that's causing the problem. It's inflammation. It's stress, sugars. There are other and many stressors that will cause this to take place. This is just not cholesterol, I can promise you. Usually cholesterol's job is that when there becomes inflammation of the inside of the muscular wall of the artery, cholesterol seems to go to the rescue to try to help patch it up and do its job. That's just the way Mother Nature works. But it's not cholesterol. Cholesterol's trying to work, but it's the other stressors like the high triglycerides and the excess sugars and the toxins that's actually causing inflammation. Inflammation is tied into this. To me, that's the number one. It's not cholesterol. Let's look here just at the artery. You can see here, this shows a buildup of cholesterol. But again, what goes on underneath, like extra calcium and other changes that the body is sending into the area to help the inflammation. All right, you can see if there's anything that's obstructed, you lack blood to the heart, they call it a heart attack, to the brain, they call it a stroke, to the lung, a pulmonary embolism. It doesn't matter what you call it, just means that there is obstruction. So we're kind of on the same page there. So let's move on to here, and this is what I'm going to be talking about. These are, to me, like the brother and sister of the miracles of healing. And I want to go over a few important facts with you. Let's go ahead and basically we look at garlic. The main ingredient is allicin, and this is what has the antibacterial, antiviral, antifungal. It's an antioxidant properties that it has is good for keeping the body healthy. And there's no question that the garlic is one of the best for heart health. It vasodilates the artery, lowers the cholesterol. It just flat out stops and slows down heart disease. There's no question in the world. That's already proven. That's been out years and years and years. So if we go on to a couple things, and I'm going to kind of mix this because I have a few things I want to say, and I'm not in any particular order, but I want to talk briefly about this garlic. Here is a situation that this was the Los Angeles Biomedical Research Institute at Harvard UCLA Medical Center. The whole purpose of the study was to help prevent progression of heart disease. The study demonstrated the main thing here, the benefits of the supplement in reducing the accumulation of soft plaque and preventing the formation of new plaque in the arteries, which causes, obviously, heart disease. The study was involved 55 patients between the ages of 40 and 75, each of whom were diagnosed with metabolic syndromes and other problems. The participants were screened in the beginning of the study to measure their total coronary plaque volume, the dense calcium, because obviously there's always calcific changes that take place with inflammation, non-calcific plaque, and low attenuation plaque were also screened. The screenings were conducted through cardiac computed tomography, which is angiography. They image this, they can see it, they can measure it. So after being evaluated, the participants were either given a placebo or a dose of 2,400 milligrams of aged garlic extract each day. 1 year later, the study demonstrated of those who had taken the aged garlic extract had slowed the total plaque accumulation by 80%. 80%, that's huge. Furthermore, they reduced soft plaque and demonstrated regression of low attenuation plaque. So this was actually published in the Journal of Nutrition, and the findings actually fall into line with a study in the past at the University of Missouri, as well as other studies that actually went on and on. But this was a major, major study showing how it reversed the plaquing, which is quite amazing. We look at omega-3s. Omega-3s is another thing that works hand in hand. Here's another thing on garlic I wanted to bring out here. This particular study, we know what it does when it comes down to vasodilating, lowering blood pressure. Here is evidence summarized by Memorial Sloan Kettering Cancer Center. Sloan Kettering is probably one of the most recognized institutions worldwide, not just in the country, but worldwide. If you listen to this outside of the United States now, primarily what they're saying here, it eventually reduces plaque, according to Sloan Kettering. A review here, also in molecular nutrition, they indicate that it slows or reverses the depositing of plaque by reducing inflammation and slowing the oxidative changes that take place. It lowers LDL, it reduces arterial plaque, it goes on and on and on. The bottom line is it's reversing the plaquing, it's helping take away cholesterol, and it's saving lives. Here's the situation here, omega-3. This was, according to the experts, University of Maryland, consuming supplements of these unsaturated healthy fatty acids. It lowers blood triglycerides. It raises the HDLs, which is the good cholesterol. It keeps the blood cholesterol in range, obviously. It prevents inflammation of the arterial lining. That's what we're talking about, which reduces the risks of blood clots, both of which promote plaque deposits. Clinical research shows that the omega-3s, it promotes arterial health. Other studies here in through endocrinology and metabolism, they go on and on and on. The bottom line is that we know omega-3s, fatty acids, are a tremendous help in reducing plaquing formation. The most important thing is we take in so many omega-6s, we need to raise our omega-3s, our flax seeds, our chia seeds, your fatty fishes. My favorite is the chia because the insoluble fiber in the intestine grabs the cholesterol. It actually gets rid of that crappy cholesterol, sends it back to the liver so it can be excreted out of the body. And I'll go into about the supplementation after, but I wanted to bring that out to you. I think that was very, very important. I also want to mention here about the omega-3s. Obviously, it reduces platelet aggregation. That means that platelets cause clotting. So if it reduces platelet aggregation, it actually prevents the ability of these platelets to stick together. When they stick together, that's when more inflammatory changes occurs in the arterial walls, which obviously encourage blood clotting. It acts as a blood thinner. It dilates the blood vessels. And here it will decrease triglycerides. It will lower LDLs. Actually, lower the total cholesterol. But as I say, we need to make sure we watch that ratio of omega-3s to omega-6s. The higher we bring up those omega-3s, because omega-6s we eat all day long. They're hidden in our foods and we get so much of them. I ask you to Google omega-6s and you'll see the foods that you are eating that you need to hold off a little bit. Okay, so from that perspective, not so much it's cholesterol. Remember, cholesterol is like the rescuer. When there's inflammation, high triglycerides, high sugar, poor diet, refined foods, I would tell people out there, exercise, do aerobic activity, lots of fluids, increased metabolism. This is what's going to cleanse. But my favorite, I love that chia pudding for some reason. Of all the omega-3s, the chia, ounce for ounce, weight for weight, that is the best. All right? It's just very, very powerful. Let me just see if I have missed out on anything else I wanted to talk about. There are lots of studies here, and I don't want to go into every study. Let me just see right here. We talked about that. But pertaining to dosages, I just want people to realize one thing. Pertaining to omega-3s, get a good omega-3 formula if you're not eating the foods. I always love the foods. The omega-3s in chia are tremendous. Flaxseed is good. Fatty salmon, anchovies, fatty fishes are excellent. Walnuts are good. If you're eating a good diet, you don't really need to supplement, but I want to make sure you're getting enough omega-3s. I like to take anywhere between 1 gram to 3 grams a day. Splitting it up is, to me, the best. I'm a big believer taking everything with food. I think just to metabolize the nutrient is going to be better for your system. When it comes down to the garlic, realize the University of Maryland Medical Center recommends 2 to 4 cloves of raw garlic per day when used as a health supplement. There are different dosages for that, but realize that today things are a little bit more advanced. They have lots of odorless brands. You can Google those. You can go through Amazon. And generally they come approximately 1,000 milligrams, and the recommendation there, depending upon, can be anywhere from 1,000 up to 2,500, split up throughout the day. But it depends upon the brands. There are different factors, so I don't want to go ahead and give you that one answer. So the only issue that you may have with raw aged garlic is that odor. See our video we just did with bad odor of the mouth. If you start supplementing with parsley and really good chlorophyll products, you're going to be able to rid off that odor. Okay, but there's nothing like the real thing. I could tell you, in any food in this earth, there's really nothing like the real thing. So supplements are good. I'm not here to knock any supplements, but I do want to state for garlic and for omega-3s, I like them used together. That to me is like the magic formula. I've seen a lot of miracles on amazing things. I have a very dear friend. I got to get him on here with us here. Dr. Andre, he's one of the chief cardiologists out here in South Florida. He's well recognized, and my thoughts are just like his. I learned a lot from this fellow, and his little idea was bringing these omega-3s and these garlics together. There's a million different things you'll see on YouTube and through the internet, and they talk about 20, 30 different things you should do to help clean out the arteries and lemon and this. But these two seem to work really good. They're powerful. Sometimes we learn so much, we try to do so much, we try to take so many vitamins, we seem to get lost in our thinking. So sometimes we just keep it real simple. This is really proven stuff. This is great stuff, and this is cutting edge stuff. I really hope that you enjoyed this video. I ask people out there to subscribe so we can continue to give you the cutting edge. I ask you to check out my videos on my channel. Great self-help, probably the most self-help for neck conditions, poor posture. We have hundreds of them, anywhere from musculoskeletal injuries, and we've been really hitting the cutting edge on nutrition. We've been getting some great feedback, helping hundreds of thousands of people worldwide, and that's why we're here. We just want to see good health, see great things, and lots of love, and lots of good lives and good years for all of us in the future. I wish you, your loved ones, lots of good health and lots of many blessings. And again, leave your comments below. You could actually leave comments on Facebook at Motivational Doc on my Facebook, on my fan page there. I try to get back as many of questions as I can, although it's hard on particularly here on YouTube, is because Not only do they get so many, sometimes I don't get them at all. So we're trying to continue to do the right thing for everyone. I wish everyone a good health, and we'll catch up with you real soon. Bye-bye now.